You walk up to your houseplant, and something feels wrong. The leaves are drooping, the color is fading, and the whole structure looks tired. Those yellow leaves and brown spots are specific biological signals your plant is using to communicate distress. Your first instinct is likely to panic. You might pour in more water, move it to a sunnier window, or add fertilizer all at once. But guessing won't fix a sick plant. If you want to save it, you have to approach the problem like a doctor. You need a systematic diagnosis. Before we begin the protocol, set the stage. Move the sick plant to a well-lit area so you can see clearly. Do not water it, do not fertilize it, and do not trim anything off yet. Your only job right now is to look. Putting down the watering can and taking a moment to observe the symptoms is the single most effective action you can take to keep a dying plant alive. Step 1 is evaluating the foliage. Leaves function as a plant's primary health report, and their color tells you exactly where the breakdown is happening. If you see uniform yellowing concentrated on the older, bottom-tier leaves, the plant is likely sitting in too much water. The roots are suffocating, and the plant is abandoning its oldest growth to survive. This animated diagram shows exactly why location matters. The plant on the left shows yellowing at the base, indicating suffocating roots. But the plant on the right shows yellowing associated to the newer, top-tier leaves. That top-down yellowing points to a nutrient deficiency, usually a lack of nitrogen or iron in the soil. If the leaves aren't yellowing but instead have brown, crispy edges, the plant is drying out faster than it can hydrate. This points directly to underwatering or extremely low ambient humidity. And if you spot dark brown or black patches surrounded by a distinct yellow halo, you are looking at a fungal or bacterial infection actively spreading through the tissue. Step 2 takes us below the surface. Once the leaves give you a direction, you need to verify it in the potting soil. Stick your finger 1 to 2 inches deep into the dirt. You need to feel exactly what the roots are experiencing. Note whether the soil is completely soggy, perfectly damp, or bone dry. Here is an anomaly to watch out for. If the soil feels entirely wet, but the plant leaves remain wilted and dehydrated, you have a severe root rot issue. The moisture is there, but the roots are dead and physically incapable of absorbing it. The leaves broadcast the type of distress the plant is experiencing, and the soil test immediately grounds that distress in an immediate environmental cause. Step 3 moves to the structural foundation. We need to check the stems and the overall posture of the plant. Feel the base of the stems. A mushy, soft texture confirms that rot has traveled up from the roots. On the other hand, stems that feel shriveled and weak confirm severe dehydration. Next, check the posture. This time-lapse shows a plant physically stretching, elongating its stems, and leaning heavily toward one side of the room. A plant exhibiting this extreme posture is starving for light. Contrast that stretching with leaves that develop pale, scorched patches right in the center. That indicates the plant is receiving excessive, direct sunlight and is actively suffering from sunburn. Step 4 requires looking closer. Get right up to the plant and inspect the hidden areas, the undersides of the leaves and the joints where the stems meet. You are looking for microscopic evidence. Tiny, delicate webs indicate spider mites. A sticky, sap-like residue points to aphids, and small, powdery white dots are a clear sign of mealybugs. What makes these pests dangerous is their mimicry. The microscopic damage they cause drains the plant's resources, often resulting in yellowing or curling leaves that look identical to a simple watering issue. When plant owners skip checking the stems and inspecting for pests, they inevitably treat the wrong disease. Step 5 is the synthesis. We now bring together every observation we've recorded, from the leaf color to the soil moisture, to form a definitive diagnosis. The most common mistake at this stage is to isolate a single symptom. You cannot form a conclusion based on one yellow leaf. You have to look at how the symptoms overlap across the entire plant. Consider this first diagnostic equation. If you have yellow older leaves, plus soggy soil, plus mushy stems, that combination locks in a diagnosis of overwatering and root rot. Now compare that to a different set of conditions. If you have brown, crispy edges, plus bone-dry soil, plus drooping stems, you have a confirmed case of underwatering. And for a third scenario, if you find spotted or curling leaves combined with fine webbing or sticky residue, you are dealing with a pest infestation. By analyzing these symptoms as a single biological system, you reveal the actual state of your plant's health. If you follow these steps, you've successfully completed a systematic diagnosis. You are no longer guessing. And this reveals a core truth of plant care. Accurately diagnosing the problem takes careful observation and logic. But once you have the answer, the execution is incredibly simple. You just adjust your watering schedule, move it to a different window, or wipe leaves with pest spray. Understanding a plant's silent signals removes the anxiety from the process. It turns plant ownership from a stressful chore into a confident, rewarding practice. Learning this diagnostic language changes how you view the nature growing in your home. If you want to keep learning how to read those signals and prevent these issues before they start, subscribe for more science-backed guides.